Thank you, Dr. Sanket, for joining us.
Thank you for having me.
And heartiest congratulations for bringing in AI into the healthcare. And you're one of the leading oncologists.
Yes.
So can you throw some color on the current gaps in the and how does AI help to bridge it?
Yeah. So in India, healthcare is fragmented because we have the private sector, the government sector. We have different patient journeys because we don't have universal health insurance, and patients have to pay for their own treatment. Yes, there are the government schemes which help, but they have their own limitations because they can only be given in government institutes or charitable institutes, and which is why healthcare access is a problem. From the doctor perspective, we are constantly short of time because the amount of work is more, and that sometimes leads to fragmented care to the patient or inadequate care to the patient because we cannot get the required amount of information, or certain repetitive tasks which we can potentially automate are not being done as of now. And that's where I think the real scope of AI is in bridging these gaps and connecting the dots in the healthcare segment. Right from diagnosis, you have patients. Most diagnostic centers, if you consider in India, do an average of 80 to 100 scans per day, which is 5 times the global average for the number of scans per day.
My goodness.
And obviously, a radiologist who is so overworked is bound to miss certain findings.
Sure.
If there is an AI system that can automate the reporting, and the radiologist just has to confirm the findings, the quality of reporting, the quality of diagnosis, and in turn the care to the patient would be better. From diagnosis, when we move to primary patient care, there is a lot of scope for AI to automate history taking, automate copying of the various reports, summarizing the histories. In MDT, so that's multidisciplinary team meetings, we can summarize patient records to give a more comprehensive view of what the patient is suffering from, so that the different doctors can collaborate and give better care. In the operation theater, I'm a surgeon, so in the operation theater, we now have AI-based softwares which are used for 3D modeling of organs so that we can do more precise surgery. We have navigation systems which are AI-based so that we can cause minimum damage to the organ to retrieve a tumor, and that improves outcomes and increases safety for the patient. In the post-operative care, there are newer AI systems which are integrating with the current existing EMRs to raise alarms earlier based on investigations, based on patient parameters, which may be subtly missed by humans, where the AI comes in and red flags those events to improve patient outcomes. So multiple areas in which we can leverage AI to bridge the healthcare gaps that we currently exist in India.
What is the importance of organ-specific approach?
So if you consider oncology, we have various organs from head to toe. You have head and neck cancers, you have breast cancers, thoracic oncology, so lung cancer, esophageal cancer, mediastinal tumors, hepatobiliary cancers, upper GI, lower GI, gynecology, urology. So there are multiple different organs. Each organ is affected by multiple types of cancers at various stages, and each of this requires a specific surgery. Now, it is humanly impossible to master every single type of surgery because the average learning curve for each type of surgery is between 20 to 150 cases. And that means that it would take a lifetime to just cross the learning curve, which is not in the best interest of the patient. Which is why you need doctors who concentrate on specific organs so that they can scale that learning curve faster, give better, faster, more precise treatment to the patients, because ultimately it compounds to more safety, lesser complications, better outcomes, and better survival.
Talk to us about your partnership with Qure AI.
So Qure AI is a FDA-approved AI-based platform that leverages AI technology to diagnose early lesions on X-ray and on CT scan. And this, again, it can detect lesions which are as small as 6 millimeters in size and give us an indication what it is likely to be.
Sure.
Either a malignancy or a tuberculosis or something else. And that can direct our investigations in a more focused manner to diagnose early cancers. The only stage at which lung cancer is essentially curable is in early stage cancer, where surgery is the only modality which is required. You don't need chemotherapy, targeted therapy, or immunotherapy for the treatment. And with that one single surgery, a patient can be cured. The problem is 80% of lung cancers are currently diagnosed in stage 3 or stage 4, where surgery is not possible and cure is not possible. And the idea is to bridge the gap from 80% advanced cancers to 80% early stage detections. And that's where Qure AI comes in. We are proud to say that we are their first partners in Mumbai city, and we are going to implement this technology across all SSO centers as we expand and reach out to other parts of the country to ensure that we not only give the best in class quality care and surgery, but also detect patients early where the surgeries are actually the most beneficial.
Fantastic. I think it's going to change the whole game.
We hope to.
Yeah. And your final words for the viewers?
I think more than anything else, what India needs is awareness of the disease, awareness of early detection and the importance of early detection. Nobody is free from the risk of cancer. Only 12% of cancers are caused by tobacco, which most people think is the only cause of cancer. You can get cancer without any known cause, and therefore early detection, awareness, and early treatment is the way to go forward.
Early detection is the key, and AI is the best tool. All right. Thank you so much. Keep up the great work. Nice.
Thank you.